Welcome to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Ian, and I'm once again joined by Dr. Clifford Yudelman from OptiSmile, helping us to uncover all that you need to know. And today's topic is how postmenopausal bone loss can affect your jaw, your gums, and even your dental implants, and also what you can do to keep both your teeth and your bones strong. So let's dive in. Dr. Yudelman, welcome back once again.
Thank you. Thanks for having me back. Great to speak to you again. And yeah, looking forward to getting going with the next 10 podcasts. Today is number 71. We'll be at number 80 before you know it.
Excellent. Dr. Yudelman, I want to start off by asking you, how does osteoporosis affect your jawbone density and your overall dental health?
There's a few important points to make here. One thing with osteoporosis is it reduces what's called alveolar bone height. So alveolar bone is the bone around your teeth. If you lose a tooth, that bone disappears. So alveolar bone is the bone that belongs to the tooth, around each tooth. And this can lead to increased tooth mobility and root exposure, or like we've spoken about, recession. Studies have shown that postmenopausal women with low bone density have got much thinner, it's called mandibular cortices. That's the actual thickness of their jawbone on X-ray. And a reduced jawbone can accelerate, like I said, gum recession, but it can also complicate gum or periodontal therapy. And early detection with routine X-rays can show these changes long before any symptoms arise. So that's in a nutshell.
Okay, and which osteoporosis medications most commonly impact oral tissues or healing?
The most common one that we see a lot of is oral bisphosphonates. These are drugs that they give to patients who have got osteoporosis. And there's something called like jaw necrosis. If you have osteoporosis and then you're on one of these medications and you have an extraction, for instance, your jaw bone can literally die. You don't get very good healing. It's called MRONJ. A lot of times, if a doctor's on the ball, before they give a patient these tablets, and we'll get into a few of the other types as well, they will send the patient to the dentist and say, tell your dentist you've got osteoporosis and we are going to start you on this medication. Ask the dentist to have a look if any teeth are going to need root canals or extractions, because it's better to get that done before you start on these medications to prevent this type of problem. So there's another one called denosumab. It's quite a hard word to pronounce, and that's got a slightly higher risk of this MRONJ, and it requires similar surgical caution. And, you know, we've got to liaise with the physicians. And then lastly is intravenous bisphosphonates, which are for cancer, and they carry the much higher risk. And implant placement is generally not recommended in people who are on long-term intravenous bisphosphonates. A drug holiday, meaning if you actually stop taking it for a little while, it hasn't been proven to reduce this MRONJ, this necrosis of the jaw. If you're on oral, once you're on it, you're on it. So you really want to make sure, if this is you or a relative, your mom or an auntie, to tell them, because usually when they find out they've got osteoporosis, or I'm going to be on this medication, or I'm going to get some pills to take, be sure, if you're listening to this, to tell them, go and get your teeth checked with a good dentist, get a 3D X-ray, get a thorough exam, and any teeth that you've been hanging on to that are maybe dodgy, that might need to come out. Nobody wants to lose a tooth, but if it's not going to be with you for the rest of your life, then it might be a good idea to get that tooth removed now.
And Dr. Yudelman, any early warning signs that post-menopausal patients should watch out for in their mouths? Post, of course, meaning, after menopause. Yeah.
Yes. So, I mean, I've known a number of people who've gone through menopause. It can be a terrible thing if they don't get hormone replacement. Now to add to it, aside from hot flashes and other symptoms and things which are actually treatable with hormone replacement, to add to that is a sensation of looseness or wobbly teeth without any obvious gum disease, or new gaps developing between teeth, which coincides with gum recession. If you start getting recession and then a gap between your teeth, like a tooth starting to move that's been in place for 50 or 60 years, that's something to worry about. If you've got your extra root sensitivity to cold or to sweets, that could mean you're getting recession or more exposed dentin. We've done complete podcasts on these subjects before. And then delayed healing after routine procedures like a deep clean or an extraction, or any non-healing, that could be a sign that you already have osteoporosis. Even without bisphosphonates, your bone doesn't really heal as well. We always think of osteoporosis and a broken hip, which is quite common, people falling and breaking a hip, which is a terrible thing. A lot of people don't survive a broken hip if you're older, in your 70s or 80s. Look, it's not a joke.
And Dr. Yudelman, how do you assess bone health during a routine dental checkup? What do you look for?
So when we have patients, female patients in general, because it really affects females more, and after menopause, you can't just look at someone and say to them, oh, are you in menopause or have you had menopause? But we go over people's medical history, and sometimes they'll put osteoporosis and they might not have written down medication. So we will ask them specifically, are you on any of these medications or have you had an injection? We might request that they send us a copy of their previous bone scan or DEXA scan, or get the name of their doctor to chat to the doctor. We always look at patients' x-rays and see, this is on panoramic x-rays or on bite ring x-rays. We can see like bone loss on these, and we might discuss it with a patient. And then we always use a CBCT, a 3D x-ray, when planning implants or complex surgery. So we've got three-dimensional bone volume and density. If you've got a patient with osteopenia, which is not quite yet osteoporosis, that means they got lower bone density and they haven't started on medications. We always got to take that into consideration, especially if they're going to be getting an implant. And then, like I mentioned, speaking to their physician about any medication or what the actual condition is like.
Dr. Yudelman, I also want to ask you, can dental treatments actually influence osteoporosis progression, or vice versa, or not?
Yeah, so digging a bit deeper on that, one of the things we can do is functional loading, with putting implants in early and then waiting for the bone to heal, and then adding like maybe a temporary crown and adding some loading to the implant, meaning some biting, because initially you get an implant placed and you get a healing cap. We've done some programs on implants, some podcasts. We put the healing cap, but we might actually then put a temporary crown on and keep it where it's not biting so hard. But when you eat some food and that jiggles the implant slightly, and it helps the bone around the implant to heal and to make it stronger. Obviously, like we mentioned, if someone is on bisphosphonates, that can really delay any healing after extraction. And if one does have an extraction, it needs to be as atraumatic as possible, possibly by an oral surgeon who's very experienced with dealing with this type of thing, just so if you do get an osteonecrosis where your jawbone basically starts dying instead of healing, the oral surgeon knows what to do. They specialize in that type of thing. Chronic gum inflammation is really bad for local bone loss. So one really needs to be up to scratch on your oral hygiene. And obviously regular professional hygiene visits will help to control inflammation and benefit both your gum health, and in turn, you'll have healthier skeletal bone.
Now, you know what they say, Dr. Yudelman, obviously prevention is better than cure. So what preventative strategies can protect oral bone in patients with osteoporosis?
Yeah, it's the usual. You got to be really good with your oral hygiene, using a very soft bristle brush and changing it regularly. We have some soft and extra soft brushes here, and even for some of the electric toothbrushes that we prescribe or recommend for patients, we don't recommend the brush that comes with them. They make extra soft brushes for some of these electric toothbrushes for the higher end ones. Obviously flossing, and in some cases mouthwashes with chlorhexidine, especially if someone also has maybe arthritis and they don't have good dexterity, someone's 85 or 90, and getting a bit frail. There's special things we can do. There are adjunctive or additional therapies such as low-level laser. So a periodontist could also extract a tooth in someone who has osteoporosis, or even on past or current bisphosphonate treatments, and they can use a laser to help the healing. There's something called PRF, or platelet-rich fibrin. So we have a special machine here that we use where we draw your blood and we spin it in the centrifuge, and then afterwards we take out the portion that looks kind of yellow. It looks a bit mucousy, and that's got all your platelets in. That's the platelet-rich fibrin, and you can put that back into a surgical site or a socket where tooth has come out, and that enhances bone healing. It's the same stuff that they use when they do a what they call a vampire facial, or they inject it into your elbow or your knee if you've got a problem. They take your blood, spin it, and inject this PRF. So that also helps with the healing. It's sort of like stem cells, or there's a lot of like immature cells in that part of your blood that helps. And then making bite guards. We've spoken about bruxism or teeth grinding. So wearing a bite guard will really help to stop your micro traumas to your teeth, which then in turn damages or causes your gums or bone to recede. And more frequent x-rays. We might take x-rays every 12 to 18 months, when normally I will only do x-rays every 3 years on most patients.
All right, and let's talk about implants. How should implant planning be modified for someone with low bone density?
In the case of someone with low bone density, firstly, say it's someone who's planning on going on to bisphosphonates, and they've come to you and they've said, this tooth's been missing for a long time and I really want to replace it, but I'm going to be going on to these drugs, and I heard that you can't get implants placed once you start them. So what you might do, or in some cases this can be more in the realm of an oral surgeon, or in many cases a periodontist. We refer patients like that in Cape Town to Jonathan Dutoy or some other periodontists that specialize in this. And what they would do is actually stage treatment. They've got advanced training in this, and they might do a preliminary bone graft in an area that needs an implant before they place the implant. And they will also select implants that are specially made for faster, what's called osseointegration in compromised bone. They'll pick a particular implant that they know works better in those types of cases. And they would wait a lot longer for healing, sometimes 3 or 4 months before putting a crown or temporary crown. And in general, you would definitely avoid any implant placement in people who've been on intravenous bisphosphonate injections intravenously, because there's a much higher risk of this MRONJ.
All right, and then any dietary or supplement tips, doctor, that support both your bone and dental health?
Before we get into the the dietary and supplement tips, I did mention earlier, I'd like to say something that's been because I've got several family members and sister-in-laws and so on, and even lots of patients that I get into this discussion with them, is that there was a flawed study back in the 80s and 90s, Women's Health Initiative, I think it was called WHI, that said that hormone replacement causes breast cancer and heart disease and all kinds of other things. And it turns out that it's actually the opposite. Initially, there might be a slight increased risk of some clotting, but hormone replacement is still fairly unpopular, especially with uninformed gynecologists and or doctors in South Africa still, and even overseas. And if you know someone who's suffering with menopause or premenopause or is already in menopause or postmenopausal, it's never too late to speak to maybe a gynecologist or an endocrinologist or someone that belongs to menopause.org. There's international and South African branches, and they know all about hormone replacement, and it's very inexpensive. An estrogen patch that you change twice a week. You just stick a little sticker on your tummy, and if you still have your uterus, which most women do unless they've had an operation, you take one other pill that's got no side effects to speak of, and that can actually stop your bones from disappearing. It could prevent Alzheimer's. It prevents you from losing muscle mass. It reduces heart disease, and it's actually the opposite of what a lot of doctors were told from this particular study. Having said that, obviously taking enough calcium every day, like a Menocal 7, which is, you're looking at about 1,200 milligrams of calcium daily, or the Menocal 7 also has, I believe, about 2,000 IUs of vitamin D, which helps the calcium to absorb. Additionally, doctors might recommend adding vitamin A2, and then chewing fibrous fruits and vegetables, so like apples and carrots. That will functionally load your teeth, giving them a bit of something to chew on, which helps to stimulate bone. And then limiting acidic beverages like sparkling water, or especially diet cold drinks. They're very acidic, and also wine, which if they're very acidic, it can actually pull the calcium, the minerals, from not only from your teeth but also from your bone. If you're drinking like 10 Diet Cokes a day or anything acidic like that, even if it's that fake orange juice on the shelf, not freshly squeezed stuff, there's a lot of acid in there, and that's these ultra processed foods can cause a lot of damage that we don't think about.
Yeah, especially that fake orange juice that you're talking about now. I can actually taste the acid when you mentioned it.
Yeah.
They're extremely acidic. Yeah, absolutely.
Yeah. And a lot of them say no added preservatives, and then because they put in citric acid and ascorbic acid, which is vitamin C, and those things act as preservatives because germs can't live at a pH of like 2.3 or something.
Yep, exactly. Yeah. Spot on. I also want to ask you, Dr. Yudelman, how often should someone with osteoporosis visit the dentist?
A baseline of every 6 months. And if you got gum disease or there's a lot of bone changes going on, maybe someone's going downhill quite quickly, can even go quarterly, every 3 months, and then getting x-rays every 12 to 18 months. I know it sounds like a lot, but you really want to track those bone levels if it's indicated, and hygiene visits every 3 or 4 months if there's any bleeding pockets or inflammation, any sign of gum disease. Is very important because if you're 25 years old and you've got strong bones and your hormones are good and all of that, you can have bleeding gums and gingivitis and terrible oral hygiene, and your bone might go unaffected for 5, 10, 15 years. And someone else who's older and has osteoporosis or menopause symptoms, it could be the opposite. You can lose a lot of bone quite quickly. So, and then, I think that's enough on that.
And then finally, what is your top recommendation for postmenopausal patients that are concerned about their smile and bone health?
So make sure your dentist and your doctor communicate. especially if the dentist says, "Oh, you need an extraction." Tell them, give them your doctor's name. Vice versa, tell your doctor who your dentist is. They can email each other or get on a call. Normally, everything's done with email these days. View dental care as part of your overall osteoporosis management. Early intervention and prevention yield, the best long-term outcomes. And if you don't have a dentist or you're long overdue, you can book a 90-minute digital consultation at OptiSmile. We include CBCT, which is a 3D X-ray imaging. We've spoken about that in previous podcasts, and map your jawbone in detail. These days we use AI. We did a podcast about that to actually read the X-rays, and to now the latest version of the DiagnoCat AI actually puts in all the bone measurements, and one can compare it over time. It's amazing what AI is doing. And then we can make a tailored plan for you. And if you do need a periodontist or an oral surgeon, then we can point you in the right direction, refer you to the best in town. And the same goes if you live overseas or in Johannesburg. And if you aren't local or you're not planning on coming to Cape Town, I still like to offer our 30-minute free video consultation for people that are maybe stuck, don't know where to start, where to go. I spoke to a lady yesterday for half an hour. She was in Joburg and she wanted to come to see us for some cosmetic procedure because she had some gum treatment, and now she had all these spaces between her teeth where the gums were already swollen. They shrank down, and I actually told her, don't come to Cape Town. And I gave her the name of a good periodontist in Joburg and a cosmetic dentist, and told her what she should do. And also she was considering getting some fake aligners at just a local dentist, and I actually gave her the name of an excellent orthodontist that specializes in Invisalign. And this is over a free video consultation.
Wow.
Yeah, we just like helping people like that.
Yeah, that's fantastic.
And I think that's a good, and just to say, last week we spoke about video consultation, so I think that fits in pretty well with last week's episode.
It does. And for those who want to book one of those consultations, you can head on over to the website optismile.co.za, or you can simply send a WhatsApp. We'll put all these details in the podcast description as well. 071 140 0396. Dr. Yudelman, you're a star once again. Thank you so much for joining us.
Thank you very much, and looking forward to speaking to you next week.
Absolutely, and a big thank you to you, Dr. Yudelman, and also to our listeners for tuning in. And remember, while we strive to provide valuable insights with our podcast, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe for more enlightening discussions, and join us again next week as we continue to explore the fascinating intersection of dental health and also financial savvy. So until next time, keep your smile and your bones strong.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.